Hi, everybody. We're going to wait to make sure everyone can connect who wants to be in here. All right, it looks like we have a good amount of our folks in here. Welcome. My name's Ashley Chilla. I'm the Associate Director of Admission here at the Nell Hodgson Woodruff School of Nursing. And we're excited to have you all here for our first webinar for our newest program here, which is the Master of Science in Clinical Nutrition. I am recording this session, so we will be sending this out to you tomorrow as well. So you can really focus during this session about all the information, and then you can go back and review if you need to. It will be there for you. Um, we also have some wonderful colleagues here on this webinar with us. Michael Walker, who is the Director of Admission for this particular program. And then we also have our Program Director, Dr. Jennifer Frediani. The way that this webinar is going to work is Dr. Frediani is going to be presenting some information for you all about the program structure, plan of study, the outcomes. We'll talk about admission requirements, the prerequisites, etc. Once we finish that portion, we will open it for Q&A. So I'm going to ask you to resist putting your questions in the chat until we finish the actual presentation. And then we can ask the questions as much as you want until about 6 o'clock today. So that is my portion. I'm going to lend this over to Dr. Frediani. Thanks so much.
Hi, everybody. I'm Jennifer Frediani. I'm a registered dietitian and exercise physiologist, and my PhD is in nutrition. I am the program director of this new program, and it's a Master of Science in Clinical Nutrition. I wanted to start, I'm going to make everybody smaller. I wanted to start out by talking about what a dietitian is, because if you guys are on social media and all of that, you probably have seen a lot of like influencers that, talk about nutrition and give you advice. So a registered dietitian or a registered dietitian nutritionist, which is what it's called now. When I graduated, it was a registered dietitian. Basically, they're food and nutrition experts with a minimum of a graduate degree, which is fairly new. As of January 2024, you have to have a master's degree. And they complete supervised practice requirements and they pass a national exam. And then after they become an RD, there's continual education that they have to do. So these two definitions, I picked one from like a Cleveland Clinic. So it's, kind of a moderately lay person type definition. And then the second one is what Ascend, who is our accrediting body that produces registered dietitians, consider our definition. Within that RD specialty, or the RD kind of overall umbrella, there's specialty credentials that you can get on top. And so there's one in gerontology, there's sports nutrition, there's pediatrics, renal, because renal is very specialized, and oncology. And so the CDR, the Commission of Dietary Registration, which is where you take the exam through, they're the credentialing agency for all of these specialties. So, you can get your RD and then, kind of like some of the other allied health professions, you can specialize. Our scope of practice is it's dietitian is a protected title in most states. Not every state has licensure, but we have this registered dietitian that's national. So if you have that RDN, you can go into different states and usually you have to pay a fee if they have licensure. You don't have to take tests over again, as long as you keep up with your continuing education. Can't let that lapse. The term nutritionist is largely unregulated. There's actually some legislature here in Georgia where we are trying to create a dual pathway, where people that don't have the level of education that a registered dietitian has will be able to take, they'll have some supervised practice and take a few courses, and they can be a licensed nutritionist. So this is largely for people that are other healthcare providers like nurses or doctors or therapists or counselors they can actually take get a little bit of nutrition education and become a licensed nutritionist, but they don't have the level of education that a registered dietitian is. We have, 1,000 hours of supervised practice, and we have, a laundry list of 200 and some competencies that have to be met in order to sit for that board exam. And there's no board exam for the licensed nutritionist. That's, I think, unique to Georgia. I don't know if other states are going to try to do that. It was, had something to do with our laws here in Georgia. Dietitians also provide medical nutrition therapy. And so medical nutrition therapy is a very specific term, and it has to do with, insurance reimbursement. So we can bill and get reimbursed for medical nutrition therapy. So it's that clinical piece to dietetics that kind of separates dietitians and nutritionists. Nutritionists are allowed to give, if you have heart disease in your family, you need to watch your sodium and your saturated fat. Anybody can really say that. But the medical nutrition therapy is very specific. So if you have a critical care patient and they need tube feeding, only a registered dietitian can provide that. So hopefully that gives you kind of some clarity on dietitian versus nutritionist. Pretty much anybody can call themselves a nutritionist. So where do RDNs work? Most people think hospital and critical care, outpatient clinics, long-term care maybe, but there's lots of different ways that RDNs can make a living. We can work in public health departments and government agencies, think CDC, WIC clinics, that kind of thing. We can do food service, and we can work in school districts. So kind of implementing the national school lunch and breakfast programs. You develop new recipes for the kiddos, and develop menu plans, and then you can do the same thing in hospitals too, and that's more prescribed diets and that kind of thing. But we can oversee those operations. Private practice and industry. You can be in like a research and development. I recently met people from Olipop. If you guys have ever drank Olipop, or there's a lot of those prebiotic drinks now. They have dietitians working, helping to develop new products, and I think that's kind of a cool thing that we can do. Some of them do clinical outreach, so they can, because we have that clinical background in our education, we can be like a liaison between hospitals and industry. Also corporate wellness. A lot of headquarters have wellness programs, especially now, and they hire registered dietitians, maybe exercise physiologists, to create healthy, employee programs for their institutions. We also can be an academic, which is the route I took. So we can work in universities. We can work in research. So like Emory is a big research university, and there are dietitians that help other principal investigators to do, indirect calorimetry or DEXA, body composition. Dietitians can do all of that. We can also teach. So with a master's degree, you can usually teach in most programs. So if that's kind of your thing, you can do that. And then sports nutrition. So you can work with college or professional sports teams. They all hire tons of dietitians, especially with that specialty that we now have, to develop menu plans and help their athletes perform at their best. So a lot of different things. Salaries and job outlooks. So there is we do a compensation and benefits survey that's done every 2 years. So they send out a survey to everybody that's a registered dietitian, and we fill out, it's really long. We fill out this information about where we work and what we do, how long we've been there, that kind of thing, and how much we make. And so from that, the median national full-time salary is $70,000, but you have to think about where people work. So if you work in a public health department, you're probably not going to, or a nonprofit, you're probably not going to make as much as somebody in private practice. And it also varies by region. So RDNs in industry or management or higher, they have more experience, they're going to make more. As far as the Bureau of Labor Statistics, they have projections that the profession will grow 8% between well, this data was from between 2019 and 2029, and it was found to be faster than all other professions. So we are growing, and there is a need for dietitians, especially now that we are requiring a master's degree. Takes a little bit longer to get there, so we need to kind of pick up the slack a little bit. So why a master's in clinical nutrition? Like I said before, as of January 2024, the Commission of Dietetics Registration, who is the person that you like apply to sit for the board exam, requires a master's degree to take the board exam. They don't require a master's in nutrition. They require a master's degree, which is kind of odd, and I have a feeling that will probably change in the future. But I think it was to help with this transition period because we have a lot of dietitians out there in practice that have a bachelor's degree. So it's an advanced training. I think on top of a bachelor's degree, whether you've had, some nutrition training or not, this will be a lot more advanced. And I'll talk about this in a little bit. We'll have opportunities for simulation. And the training is just much more in depth than a graduate program. And then you have higher salaries with a master's degree, RDN combo. So a little bit about our program. It's 4 semesters, so 16 months. It's online and right now full-time. It's 17 courses, which equal to about 50 credit hours. And then integrated into those 4 semesters, we have 1,005 supervised practice hours. It shouldn't say starting fall semester. It's starting spring semester. And then that's all done where you live or wherever you're going to live while being in the program. So we help you find all of that and help you set everything up. But there will be 2 on-campus intensives in the spring and then the second fall semester. So everybody will come to campus. And it kind of serves twofold. One, you get some hands-on training. The first campus on intensive will be during your medical nutrition therapy class, and it kind of is prepping you for some of those clinical rotations in the hospital. So you'll feel really comfortable going into a patient's room and doing things. And then the second one will be kind of competency checkoff. So you'll come back after all of your rotations and show us what you learned. Most classes will have synchronous time each semester. So even though this is fully online, I want to stay connected with the students. And so I don't want to give you a bunch of work to do and just let you go. We're going to have synchronous time so that you can ask questions, we can have discussions, we can do some hands-on active learning things. So that will be each semester. Not every class will have synchronous time, but most of them will. So why Emory? I would be amiss to not mention the state-of-the-art Emory Nursing Learning Center that we have now. It's a 70,000 square foot space. It's in a building in downtown Decatur, which is close to where the on-campus stuff is. It has the latest technology in high fidelity medical mannequins. These things, I did not come from an education that had the access to this. Really cool. It's not everything is particular to dietitians, but they have mannequins that are in ICU, so you can kind of see what an ICU patient would look like. We're gonna teach you how to put in feeding tubes. And you have all of this experience and kind of can get a feel for it. So your first experience with an ICU patient isn't with a real patient. You walk in, it's a lot if you've never seen anybody in the hospital with all the tubes and beeps and things. So I think that's a really important aspect to this program is we're trying to make you as comfortable as possible before we throw you into a hospital. We have real clinic areas. So you walk in and there's a nursing station in all of these rooms. It looks like you just were transported into an outpatient clinic. There's a NICU. There is also a house. I'm trying to figure out how we will use that, but there's a bedroom and a kitchen. And so it's really meant for home health and to help people move around their house. Like I said, we'll place NG tubes, so feeding tubes. You'll learn how to perform swallow tests and conduct indirect calorimetry and all the typical health screening like blood pressure and glucose. All of these are in the standards now for dietitians. And even our hospital here at Emory, dietitians are placing NG tubes, which is crazy because we definitely didn't do that when I was in school 20 years ago. So why Emory Nutrition? We have education and learning specialists in-house in the School of Nursing to create innovative ways to teach nutrition remotely. So we're building AI-powered counseling bots so that you can learn motivational interviewing and you can verbally talk with a person or a fake person instead of, since we're going to be in different places, you're going to do some stuff with group work and learn, your cohort mates. But I think the AI powered, you don't have to pretend to be a patient. We can, build one of those out for you. It's hard to be a patient when you know what the dietitian is supposed to be asking you. It's hard to fake. We also are going to have synchronous checkpoints and frequent meetings with faculty for extra support. This is a really intense program. It's a lot in 50 credits and 17 classes in 4 semesters. It's pretty intense. So we're going to make sure that we're checking on you and we're supporting you in any way we can. There's also a specific course for at the end, the last semester. For board exam review. So that's kind of, I found unusual. So we have it's a 1 credit course at the end that we will help you study for that board exam because you're eligible to take it about 6 to 8 weeks after you graduate. It takes that long to do the paperwork. So this is an all-inclusive program where you get all of your supervised practice and your didactic learning all in one. So after the 4 semesters, you're eligible to take that exam. Clinical sites. So supervised practice will include hands-on learning in each of the 3 required domains for dietitians. So we have clinical, which is, inpatient, outpatient, critical care, pediatrics, we'll have renal. Community is things like WIC or nonprofit organizations and federally qualified health centers. And then food service, which I mentioned before, is like either a school or a hospital. We have a clinical placement team and experts that'll work with you to find appropriate preceptors and schedule everything. You will have the opportunity to tell us your preferences during the application process and interview. So, we can't guarantee anything, obviously, because those preceptors have to agree to work with you, but we do all of the legwork for you. So, and we make sure that you get all your hours in and everything's taken care of. So prerequisites, we have these broken up in like physical sciences and math. We want you to have biochemistry, your A&P 1 and 2 with labs, the chemistry, organic and inorganic with labs, microbiology with a lab, an introduction to nutrition, which you can find pretty much in most universities, and then either a course in psychology or sociology. For math, really just an introductory to statistics. We're going to have biostatistics that's in the first semester, that's very nutrition specific so that you learn how to read nutrition literature and journal articles. And then medical terminology, but only if you're earlier degree or you don't have any experience in the healthcare field. So we could get this waived if need be. So not all prerequisite courses are created equal. If you want, you can check and get pre-approval for prerequisites, especially if you're paying for them, over the summer. All of these prerequisites will have to be done by the orientation, which we are scheduling kind of close to the start of the semester. You can just request a course syllabus from the faculty that's teaching the course, or sometimes they're online. And it should have a course description, objectives, credit hours, of the topics, kind of outline of the topics covered. And you can, email it to nutritionquestions@emory.edu, and I'll take a look, or some of our staff will take a look and make sure that it covers all the bases. Admission requirements. So we require a BA or a BS. You don't have to have it in a health related discipline, but it's preferred. And it has to be from obviously accredited university or college. Cumulative GPA of 3.0 on a 4.0 scale, and then your science GPA has to be 3.0. We need all the official transcripts and a resume. There's an optional personal statement. And then if English is not your first language, we have the tests for that. We are going to do interviews. So we look at this process and make sure that you're completed all your prerequisites and you're meeting all the admission requirements first. They'll be conducted virtually and probably start in May. And really preferred candidates, I would say a strong candidate would have a background in science, but like I said, is not required. And this would be more like either chemistry or biology or even psychology, because we do a lot of counseling as dietitians, and I think the psychology background would actually be really beneficial. So how many students are we admitting? We are going to enroll up to 20 full-time students in this fall, so this first cohort, and that'll increase to 30 the following fall, so 27. And then our capacity is 40 students. That's what we are accredited for, and that will be in fall of 28. So we're kind of ramping up a little bit. Here's our tuition and costs. So the cost per credit hour is $17.50. And then we have some things that are additional. I think I could say this, right, Ashley? The application fee is going to be waived for this first cohort, so you can knock that off. Academy membership is the National Academy for Nutrition and Dietetics. You get a lot of perks, and there's going to be some information that will take off those websites that are behind firewalls. So you'll have to be a member of the Academy, which is a good practice anyway. Every dietitian should be a member. There is an optional for the Georgia one for those that are local, or you can find every state has a local and organization that you could be a member of. It's good to network. But it's optional. Books and labs, we're going to try to keep it around 800 or less. This includes all of the textbooks for the whole 4 semesters, plus any lab fees that we may have for sim or for, oh no, those are listed separate. For the food science class in the first semester, you'll have to buy food and things for the labs that you'll do at your house. And then there's some other fees that are kind of common to every student at Emory. So the 2 on-campus intensives, you'll have to get yourself here and house yourself. And everything you do in the lab will be covered. And then you need proof of insurance. There are some scholarships. So for this inaugural cohort, like I said, the application fees will be waived, and each student up to the 20 that we're going to enroll this first cohort will receive $500. There are for the Academy of Nutrition Dietetics, they have scholarships for nutrition students. And then there are some endowment type scholarships that we have in the School of Nursing that our nutrition students may be eligible for. So I have them listed here. I don't know I guess if this is going out as a recording, you can write them down. And then obviously most people are going to finance and do, personal funds and student loans. As far as accreditation, we are accredited. So we go through SACS, so the Southern Association of Colleges and Schools. So that's kind of for the whole university. So that is approved we have a new program. And then the Accreditation Council for Education and Nutrition Dietetics, or ASCEND, is our nutrition dietetics accreditation body. And we are granted candidacy for accreditation. So the way it works in nutrition is the first couple cohorts are under this candidacy. So you are completely eligible to sit for the board exam. And then we apply for full accreditation after a couple cohorts have graduated. And then everything is reviewed after that every 7 years. So after you graduate, you will be awarded a Master of Science in Clinical Nutrition, and this includes all the supervised practice you'll need to be eligible to sit for that board exam through CDR. And you have to wait for some paperwork, but you just schedule it at a testing center in your own area. And once you're successful, you'll be a registered dietitian nutritionist, and then you'll need to follow whatever licensure rules are in your state to become an LDN or a licensed dietitian. And that not all states have licensure. There is a compact. So if you want to do kind of a telehealth type thing, there's, I think, 15 states that are in this compact. So you only have to pay once to be an LD and be able to practice in all of those states. So you can look that up if you're interested. And that's it.
Wonderful. Thank you so much, Dr. Frediani. So yeah, this is your time to ask questions. That was a great presentation. It obviously covered a lot, but you may have some very specific questions about what is needed. So this is your time to ask. You can either come off camera and ask, or you can put it in the chat, whatever you feel most comfortable with.
And Ashley, as they're thinking about all the great questions they're about to ask, I did want to give a little bit of clarification on the application fee waiver, which we're really excited about. So it will be limited to the first 50 applicants that submit their application. And that's important to note because some of the individuals who are going to be hearing about this are going to be hearing about this via recording. So just wanted to make that clear. When you're at the point in which you're ready to submit your application, do not hit the submit button just yet. Just email nursingquestions with an S, nursingquestions@emory.edu. Let us know that you're ready to submit your application so that we can send you a discount code that'll go ahead and waive that application fee for you. So we're really excited about that. And I do appreciate that Dr. Frediani also talked about the $500 scholarship for the first cohort of students. And so that is going to be applied to your first semester's tuition, as being part of that pioneer group that's going to be joining us in the fall.
And it looks like we have a question in the chat. So just because we're in the School of Nursing doesn't mean we have really anything to do with nursing. So you don't have to be an RN or not. You can be, but you don't have to be to apply. We just are housed in the School of Nursing, but we're a separate dietetics program that has really very little connection to nursing. The only connection we'll have is some nurse is going to teach you how to put in an NG tube.
Any other questions? Again, if you want to come on camera, we always love seeing people's faces. It's nice to put faces and names together.
I was just so great at my webinar that they have no questions. Hi.
My name is Rifa. I have a quick question. So I was actually wondering about the DPD verification statement. Is that something that that's going to be accredited through the Ascend program, or is that something we have to have prior to?
No, you don't have to have it prior. So what she's talking about is if you, like, for instance, did an undergraduate program in dietetics, you may have a DPD. So you would still have to do the master's program and do the supervised practice to sit for the exam. Okay. So you don't have to have one, but it doesn't really hurt you if you do. I mean, it's better because I know you have some nutrition background. But yeah, it's not a requirement.
Okay, all right, thank you.
Michael, we have a great question in the chat about TOEFL scores and overseas applicants, and maybe you can touch a little bit about the international aspect of that.
Oh, sure. And for the international, I don't see, I see it. How much of a TOEFL score is required for international applicants?
Mm-hmm.
Yeah, that's a great question. So we don't have a cutoff score for the TOEFL. But it does give us a sense of your English language proficiency. And so, do your best on it and submit a really strong application. And then we're going to obviously compare, your candidacy with all of the other applicants that are coming through. But I would not be stressed about, uh, reaching a minimum score. Do the best you can. And we'll go ahead and take a look at your coursework. And so Dr. Frediani did make a important point there. So the program, it is open to U.S. citizens or permanent residents. And so some of the applicants that are coming in, you may have been educated abroad, and this is where the TOEFL is going to come into play. And so we would be happy to still, consider your candidacy. But this program is going to be able to support, students in one of those two categories, which is U.S. citizens or those who are permanent residents. Thank you so much for the question.
And it's really based on the fact that we're online, and that's just a rule that we can't really can't get away from.
Great. Any other questions? If not, that's totally fine. Again, nursingquestions@emory.edu. That is the email address if you do have additional questions. And we can certainly help you there or send you to somebody else who can help you. The website, if you, I'm going to put the actual website for the program in here, and that will also give you an overview of what Dr. Frediani talked about. But if you need to just go back and look at any of those prerequisite courses, they're all listed there as well. So if you do have any other questions, please let us know. We look forward to seeing you in the application pool. And thanks so much for joining us today. Have a great day.
Thank you.